The Filipino American Cancer Care now brings you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
Good evening, ladies and gentlemen. Magandang gabi sa inyo dito sa Amerika. Good morning, Philippines. Magandang umaga, Pilipinas. I'm Josie Moralidad Zayman from the Filipino American Cancer Care. Today is Friday, April 26, 2024. And syempre, we are, of course, we have this special event at Pinay Kitchen. Ito yung FACC Presidential Volunteer Service Awards Night as our way of thanking our volunteers and supporters for being there to help and contribute in the fight against cancer. We also would like to acknowledge our station manager in PHLV Radio, Mr. Johan. Thank you so much for being with us. He's the man behind the camera. And tonight, kasama ko po sa ating radio show, isa sa mga officers and our Vice President for Communications, we have Jan Andrada. Hi, Jan.
Hi, good morning to all of us here in America and good evening in the Philippines.
Yes, we are so busy because you know what? We just finished our induction ceremony at the Philippine Embassy in Washington, D.C. We have new set of officers for the Filipino American Cancer Care for 2024 to 2026. I'm sorry, I just finished eating. John, supposed to be, I should not be talking, I should not talk before I'm going to be on the radio show. But because I'm so hungry, I can't give up food. Food is life, okay? I cannot function if there is no food in my brain. Now,
Of course, we need to eat.
Yes, I would like to introduce our special guest. And John, we are so grateful dito po sa Filipino American Cancer Care because last year, you remember, we had that free cancer screening and she had a big role in making everything possible for the Filipino American Cancer Care. And we are so grateful and we deeply appreciate her service for our Filipino American community here in the DMV area. Now, our special guest tonight is a licensed and board certified genetic counselor who focuses on cancer prevention. Oh my goodness. I did that genetic testing when I was diagnosed with cancer and I don't understand. I was so afraid that they will be able to determine, everything about what's inside in my body, what kind of disease that I have to face in the future. So anyway, she started her career at UCSF. We have to ask her what is UCSF before moving to George Washington University, where she spent nearly 10 years helping those diagnosed with cancer understand their treatment options and implications for family members. When the Saville Cancer Screening and Prevention Center opened, she could not pass up the opportunity to help the program grow and focus more on prevention from every angle. She now leads the genetics, outreach, and education activities for Saville with a particular passion for helping individuals better understand their risk. Ladies and gentlemen, please welcome on our radio show, On the Air with FACC, Filipino American Cancer Care, Elizabeth Stark. Hi, Liz. Good morning or good evening to you here in the United States. Good morning to our viewers and followers all over the Philippines and other countries on the internet worldwide. All right.
Hello. Thank you so much for the opportunity to join you. It's really a pleasure.
Okay.
Good morning.
My first question, what is UCSF? University of what?
California, San Francisco.
Actually, that was in my mind.
Yeah.
Are you from California?
I am. I'm originally from California and started my career out there.
Mm-hmm. Wow. So you were born and raised in California.
Yes. Yep.
Wow, that's something new, Jen, from West Coast to East Coast.
Yeah,
So,
remember I also came from San Francisco recently for a job, and I really
uh-huh.
love the place.
Oh, I
It's so
love
nice.
San
The weather is
Francisco.
so
Mm-hmm. And the
Yeah,
food. So you met a lot of Filipinos in California.
absolutely. Yeah. There's a
Uh-huh.
large Filipino community out there.
You have Filipino friends as well?
Yeah. Yep.
Oh,
Absolutely.
so you eat Filipino food then?
Yes. Love it. All of
What's your
it.
favorite one?
I mean, it's hard to go wrong with the lumpia. I love those so much.
Uh-huh. Uh-huh. Wow. That's pretty cool, huh? Now, how long have you been working with Saville under Inova Shore Cancer Institute? And what's
Yeah.
really your, what's really your background? Are you a nursing or a nurse? I know
So
you're a
I'm an
genetic counselor.
Yeah, so that's a special master's degree just in genetics. And so we
Mhm.
focus on kind of inherited risk for cancer. Seville opened 2 years ago. So we opened our doors in May of 2022. And our mission is to help people understand their risk of developing cancer. So we look at genetics as kind of a foundational piece, but then we're pulling in things like lifestyle because we know that
Mhm.
40% of cancer is preventable through diet and exercise and not smoking and not going in tanning beds. We're looking at things like environment. So if someone is a firefighter, we know that that raises their risk. If someone is a military member who had burn pit exposure, that raises their risk. So we try and pull all of these things together in Seville to help people come up with individualized screening plans.
Mhm.
Mm.
Okay. And how long have you been in this kind of profession?
Oh, you're dating me. I think 2008 is when I switched careers.
Mm-hmm. Okay, Jan, do you have questions?
Yeah, it's a highly specialized scientific study, and it's not very common. So you must have, given your time so much on this and focus.
Yeah,
Mm-hmm.
it's a really exciting time to be learning about genetics just because it's changing so quickly and our understanding of how we can prevent cancer is changing so quickly. There are new technologies that are coming out all of the time. And here in Seville, we also have a special interest in research. So we're looking at new technologies like the multi-cancer detection tests, which is a blood test that can screen you for 50 cancers at once.
Mm.
Seville was actually just selected as one of 9 hubs by the National Cancer Institute to recruit people for these types of clinical trials and prevention. So we're really excited to have that opportunity open to the people of Northern Virginia.
Mm-hmm. We have so many topics to discuss, on this radio show, and including this event on May 18, where FACC is going to be one of the participants. And of course, we have our volunteers. Now, let's go back to being a genetic counselor. What training and qualifications are required to be or to become a genetic counselor?
Yeah, that's a great question. So, genetic counselors are a specialty 2 years master's program, and we focus just really on genetics. And so we learn about all kinds of genetics, whether it's prenatal genetics. A lot of people encounter genetic counselors when they're pregnant, thinking about having a family, but there's also cardiovascular genetics, cancer genetics, and that's where I really found my passion when I found out that there was something called cancer prevention that really piqued my interest because, like many people, I've lost so many family members to cancer. When I started grad school, I actually said, you know what, I'll do anything but cancer. I don't want to be involved with that. But when then I learned that there was cancer prevention, that really excited me because I knew that my family story could look different in future generations.
Mhm. You mentioned something about your family members affected by a cancer. So how did cancer, impact your profession as a genetic counselor? Because, Jan, once you're diagnosed with cancer, of course, it's going to be a devastating, realization. And at the same time, it's not only for cancer patients, but also for the family members, especially caregivers.
Mm-hmm.
No, absolutely. So my mom was diagnosed with ovarian cancer. Unfortunately, she passed away from that disease. And I know that her father died from cancer and his mom died from cancer. And so when we started looking into this, I really realized I want to be the first one in 4 generations that I know of that's going to live past 60. I want to make sure that I'm getting all of the information that I can. So I'm here for my 3 kids. And so that we can move into the prevention space, because some cancers, like ovarian in particular, we catch them late. We don't have great screening for them. So I started to arm myself with the knowledge that I needed so that I can take steps now to make sure that I'm healthy later on.
Mm-hmm. So you have that mutation?
So this, in my family, we weren't able to find something, but there are certain things that you can do to help decrease your risk, even if we aren't able to find a specific genetic mutation.
Mm-hmm. Okay, John?
Yeah, so I've learned that of course during our ancient years we were carnivores. So does that also contribute to, like our genetic mutation of having cancer cells?
Yeah, so we at Incivil, we focus a lot on diet, and we think about it more of things that we can add versus things we can take away. So we have a wonderful dietitian on staff who really focuses on what are the foods that are increasing our healthy cells' ability to fight off of cancer. So that's adding things like a lot of berries, thinking about a plant-based diet, kind of whole foods. We're not going to tell anyone to cut an entire food group out. We want everyone to enjoy their lives and to have, special celebrations, but really thinking when it comes down to the day-to-day, are there healthier choices I can make? So recently I've started trying to get tofu on my salad instead of chicken, just little things that I can make. Now, am I still going to have chicken? Absolutely. But I'm trying to get it away from every meal into a more plant-based diet.
Mm-hmm. Well, I just had my ham. I just finished eating. All right. Now, again, last year, it was the first time that FACC collaborated with Inova Hospital. My own experience with Inova Hospital is amazing. I love the service, I'm so proud that we live in the area of Virginia, especially Fairfax, Jan.
Yeah,
Fairfax
we're from here.
government is very good in taking care of their residents. And I wish Filipinos would avail all these services that they are offering to us. But I guess that's why, we have this radio show. We have this advocacy because we want them not just to listen to us. We want to save their lives. And that's the best thing we can do at the moment when it comes to fighting cancer. Right, Liz?
Absolutely. There are so many free resources available to everyone. And so we have community health workers on staff that can help people learn about their options. Sometimes there are special programs through the government, Fairfax and otherwise, but there's also special programs just through Inova that don't even involve the government to help cover the cost of care. So we want to make sure that everyone knows that they are valuable and that they should have the benefit of cancer prevention services.
Mm-hmm. In your profession, not just being a genetic counselor, what is your, what particularly, what platform most particularly you are passionate about, not just talking about genetic counseling, what are your passions?
So my passion really is community outreach and trying to make sure that everyone in our community has access to the same high quality services. And so we plan a number of events and try and meet different organizations so that everyone kind of knows what services around and start to make those community connections. We are always looking for community leaders because that's where the trust starts. Community organizations are where that trust is built. And then if they know how to get a hold of us, then we hope that their whole membership will know how to get a hold of us, so that we're really passionate about starting to create those connections.
So you started being a volunteer also in your, college days or high school?
Yeah, absolutely. So I volunteered in our health center when I was in college, helping other college students learn about the health center services and how to be an advocate for when there were problems that came up. And then I moved into teaching. I joined Teach for America, and I was a seventh grade science teacher. Again, trying to make sure that we're getting out into the community and so that everyone can get a high quality education. And then that's when I moved later on into genetics, again, trying to take my passion for healthcare, and again, make sure that those resources are available to everyone.
And I'm sure you have a diverse group of friends because of your passion in terms of community outreach.
Absolutely. That's what makes, life so interesting is you get a whole bunch of different people with different backgrounds together. Yeah, I love that.
John?
Yeah, I think our outreach is really very good because it breaks the barrier between the hospital facility and of course the people who think that going to the hospital is already like the end stage or something. But when we start doing outreach, people began to really know that everything's preventable, and we could really participate in all these programs of the hospital or the institution, right?
Absolutely. And we're always so grateful for people when they're willing to just ask a question. I know it can feel scary. I know what it's like to have
Yeah.
multiple generations of your family diagnosed with cancer. But when we really start talking about prevention, I think you'll just be amazed at what opportunities are available that can help us kind of help ourselves.
Liz, I've been in the business of media for almost 30 years now. I could tell that your voice alone, you have that lovely and sweet voice, John. You notice her? She has that very sweet voice that I think just talking to you, you don't need to say anything. Sometimes my voice could be very intimidating for others, even though I'm very tiny. Because, I sound like I'm very tough. But I'm not. I'm actually not. But your voice, and I also notice it because here's the thing: we're Filipinos, okay, and we were not used to this American culture. And sometimes when they talk, it's like, it's like there's a command, right? And most of the time I'm intimidated. But the way how you speak, I don't know if I'm the only one. I'm not trying to flatter you, but that's the kind of voice when you deal, especially with other cultures. They like that kind of sweet voice. You don't really have to say anything longer than whatever it is. Just listening to someone who has that sweet voice, it means to another person.
That is very
Yeah,
kind.
you could really feel the care that you have
It's a caring
naturally.
voice. I think it's a caring voice.
Mhm.
And I think you'll find that across all of Seville. Like, we know that no one wants to come here, right?
Mhm.
Nobody's top of their list is to come talk about cancer. And so we're trying to create a place that is warm, that is welcoming, where everyone feels heard. Because again, we want to provide those opportunities for everyone in our community. Even genetics, when you come in and talk to a genetic counselor, you're not saying, I'm absolutely going to do this. You're saying, I'm going to learn about what my options are. I'm going to learn about what tools and resources are available so that we can come up with what the best decision for you is. That doesn't necessarily look like the best decision for your neighbor. I really believe that there's no one right answer, but there's a right answer for you.
Right.
To help you figure out what that is.
And you don't have to sound like intimidating to others. Now, because sometimes, like, even if I go to a doctor and the doctor doesn't sound good to me, I know we cannot blame them because that's the way how they sound. But with that compassion, that caring, it means a lot to to any individual, to humanity. You know what I'm saying? But anyway, I still have a lot of questions.
Well, we could say that it's really personalized caring, right? Because it's individually targeted.
The doctors that come down to Seville are choosing to do so. Most of our doctors are oncologists in Shar that see cancer patients, but they say, you know what? I want to have a special day in Seville to help people not get cancer. So it's a
Mhm.
very special type of person that's choosing to come down here anyway. So I think you'll find our entire
Yeah.
team is very warm and welcoming.
Liz,
Mm.
a lot of people, they're afraid of cancer. They're
Mhm.
scared of cancer. They don't even want to discuss it on the table, anywhere. They don't even want to watch a commercial on TV about cancer or listen to anything about cancer. And some people, they don't even want to attend any cancer activities or advocacy. Now, how do you help individuals, understand their cancer risk?
Yeah. No, that's a great question because that's a very common thing that we see across a lot of different communities and often a lot of different age groups. So if we go back a few generations, we would find that someone's like, oh, I don't even want to say cancer. I'm going to say the C word. We didn't share that information in our families. And so what we're trying to help people understand is, especially from a genetics perspective, what I'm looking at is information that's been in your body from the day you were born. It's not
Right.
changing. It's not coming or going.
Agree.
And it doesn't mean you're
Mhm.
sick. It doesn't mean you have cancer. But what it does tell me is, can I help you make a different screening path to better take care of you? Because there are some cancers that we can prevent altogether. And in other instances, if we can catch a cancer at stage 1, that's very different than
Mhm.
catching a cancer at stage 3 or 4. The options you have open to you are very different for a stage 1 versus a stage 3 or 4 diagnosis. And so our role, again, is just to help people get information so that they can figure out what their best path looks like. This is a very collaborative conversation, but genetic testing is never going to tell you that you have cancer. It's never going to tell you that you're definitely going to get cancer. It's just going to help us make that better, more personalized plan for you.
Jan?
Yeah, so it's more education and like making people aware that it's not really something that's uncontrollable, right? So yeah, this is a very good advocacy.
Mhm. Now let's talk about this event on May 18, and that's a Saturday. What event is this? And who is invited to attend? I know we registered.
Yeah, no, thank you so much for the opportunity to share this. So this is going to be our 3rd annual community health fair. And what this is, it's on Saturday, May 18th from 9 a.m. to 1 p.m. here at the ICPH campus in Fairfax. And it's going to have free cancer screenings. So we're doing free skin screenings. We're offering free colon cancer screenings for those who are 45 or older. But it's also a whole day of interactive exhibits. We have giant inflatable lungs. We're going to have the robot that actually does some of the lung biopsies. We're going to have cooking demonstrations. We have mindfulness, like the VR goggles to help people control their emotions. We've got bounce houses and fun kids activities to get people healthy, and then tons of expert lectures and amazing community organizations like FACC who can share their information and their resources with community members.
Mhm. And
It's
what
free
type?
and open to everyone.
Wow. If, for example, I would like to get a skin cancer screening, but I have an insurance. Would I be able to avail it, or is it only for the non-insured?
No, this is for everyone. So it's kind of first come, first serve. We're going to have 4 dermatologists on staff who are going to be doing those skin screenings. And so when you come up to the event, you'll just sign up and we'll have it free for anyone who wants to do it.
Mm-hmm. You know what? I'm going to announce this today. And now I'm thinking, because I can't get this schedule with my dermatologist for the annual checkup of the skin, I think I'm going to do this, Jan. How about you, Jan?
Oh yeah, definitely, because at least since it's preventable, everybody should really take advantage of what is being offered, right? So this could be a continuing program for us
Mm-hmm.
too, a partnership.
Mm-hmm. So everyone will be able to participate. Now, what types of entertainment? You mentioned something about inflatable lungs.
Yeah, so there's giant inflatable lungs that you can actually walk through and see
Oh,
the structure of what that looks like. There's a giant inflatable colon that you can walk through and kind of see what the colon looks like. But we'll have food trucks on hand. We're going to have, again, cooking demonstrations with free samples. We're going to have bounce houses. Like it should be a great day. We're really excited about
Mhm.
it. We'll have artists roaming around. We have our chief comfort officer, which is our therapeutic dogs that will be roaming around. So it's going to be really fun.
Mhm. Is this only available for Fairfax residents?
No, this is completely open. Anyone who wants to join us is more than welcome.
Oh my gosh, this is great, John.
yes,
I
that's
think,
very exciting.
yes, people should not be scared of cancer. And as what I experienced, like, a few weeks ago or I think last week, we had a burial of my brother-in-law who passed away from metastatic prostate cancer and bone cancer with Parkinson's disease and stroke. This is actually what he told me. Everybody should be tested. We are in America, Liz. I hope one day you would be able to visit Philippines because last year I visited Philippines after 21 years and I saw how people with cancer, kids with cancer, they suffered so much. And in the Philippines, they would love to have this free cancer screening. It's just that we have the best doctors and nurses, but we don't have that technology and resources.
No,
Yeah, plus,
absolutely.
Josie,
Growth.
yeah, yeah. But, of course, when we talk about cancer, it's already expensive kind of disease because, like, all the kinds of treatments and the diagnosis is really like scary. That's why the initial reaction is denial. Like they try to, not accept the thing that they were already diagnosed. So yes, it is really something that not everyone is happy about, right? I
Mhm.
mean, in general, I mean, everyone is not happy when they talk about cancer. So, yeah.
Would you like to add something about this, please?
Yeah, I mean the cheapest treatment is prevention. So we want to make sure that
Mm.
everyone again is thinking about what's in their control, whether it's stopping smoking, whether it's the HPV vaccine, which protects against cervical cancer, but also head and neck cancers, adding more plants, getting more exercise. Like all of these are great ways to help reduce cancer risk that are in
Mhm.
your control.
I like your words. The cheapest what did you say? The cheapest
This
way
treatment prevention, yeah.
is prevention. And
Right.
also you mentioned, John, that cancer is a high-end disease, okay? It's more expensive than Gucci. It's more expensive than Louis Vuitton. Because if you're poor and you don't have money for treatment, you're going to die. And we are actually very fortunate, in this area. That's why I always tell people we are so blessed. Okay, I had cancer. I'm done with my treatment. But that's the reason why we have Filipino American Cancer Care. Because I have my insurance, I am capable, I have my husband who can take care of me. But those people in other countries, it's worse. In Zimbabwe alone, in Africa, there is only one cancer center in the whole country.
Mm.
And that breaks our heart just, because cancer doesn't discriminate. Everyone is affected, no matter where you came from. And whatever your race, cancer is there. We just don't know when it's going to hit someone. Now, anyway, going back about this event, again, on May 18, it's going to
Mhm.
start at 9 o'clock or 8 o'clock.
9 o'clock.
9 o'clock until what time?
1 p.m.
1 p.m. Wow.
So,
Nice.
yeah, so it's not a whole day affair. Like,
Yes, they have time to go
so
shopping afterwards. Mhm. Are there any costs associated with informative sessions and cancer screenings?
No,
Nothing.
this is an absolutely free event for the community. There will be lots of giveaways on top of the free screenings, the expert lectures, the cooking demos. It's all free. We even have tickets for the food truck. So we hope everyone will come join us.
Well, we can get free tickets, food trucks. So, what kind of food? Asian, Mediterranean, what?
I'll have to check.
Definitely is healthy.
Yeah, definitely healthy. I know they're going to have some smoothies, some green
Mhm,
smoothies. I think they're going to have
Mhm.
a more
mhm,
Mediterranean type option. But I'll have to check with the food truck team. I don't remember
mhm.
which ones they had.
You know, this interview, I'm going to put it on our Instagram account, Facebook, and also on our website. You know, Liz, if you go to the website of the Filipino American Cancer Care, in the home screen, you will see. You will see the free cancer screening activity that we had last year.
Oh, wonderful.
Yes, it's there. And we're going to do more campaigns because this is the only way we can help our, others. And this is the
Mhm.
best way to have an impact with another person or the community.
Yeah. And I'll send you the link for anyone who wants to register for the free
Yes,
event.
I
Register on.
did.
As early as now.
Uh-huh.
Yes,
I
early as
sent
now.
it
We
to
should
our
be campaigning
contacts.
for that.
Yeah. And
Oh,
we
perfect.
actually posted something, but I think it's better if you have more this video because they understand. They will listen. And I'm gonna make a reels out of this because this is, Jan, this is about fighting cancer. This is about cancer
Mhm.
advocacy. We live in the area
Mhm.
of America. This is the capital of America. We have the best minds, best doctors.
Of course. Yes, and they're reaching out already. It's not that we go to them, that they go to a lot of people, right? So yeah, let's help in the campaign and let people be aware that there is something like this to make them, feel comfortable in trying to see what's going on in their body.
Mhm. Now, aside from cancer advocacy and cancer screening, what is really the primary goal of the event in terms of promoting health and wellness?
We're just trying to make sure that everyone knows what resources are available to them, that our community has access, they have contacts, they can ask questions. We're going to have a lot of doctors on site who will be able to do kind of little sidebar FAQ sessions just so people can learn what their options are and how they can help take control of their health. So it's
Mhm,
really just about educating the community about how much control they have and then being here in partnership with them if anything does come up that they're concerned about.
mhm. How many doctors we're going to have in this fair? Are
Oh,
we
a
going
lot.
to have a lot? Oncologist?
Yeah. So Dr. Kaltman is our executive director for the Seville Center. She will absolutely be there.
Mhm,
We have a doctor doing a talk on GI screening. We've got a doctor talking about cardiology because there's a lot of
mhm,
overlap in prevention for both cardiology and cancer. We have a gynecologist. We have a researcher. We have our uro oncologists, we have our dermatologists, you name it. There's going to be a
mhm,
lot of doctors on hand.
mhm. Is there going to be a pap smear screening?
We aren't doing any PAPs at the event today, but we're
Mhm.
happy to help people who are interested in that, get them connected with some resources.
Mhm. Will there be any giveaways or informational materials provide to attendees?
Absolutely. So there will be tables on all of the different disease sites. So whether it's breast cancer, colon cancer, GI cancers, there will be informational tables that will have giveaways and informational booklets where people can get information, ask questions. We'll even have people on hand to help schedule appointments if someone wants to make an appointment with the Seville Center.
Mhm. And you always monitor these patients, right? If you found out that uh, they're positive for cancer.
Yep. Well, then we have the other side of the building, the Shar Cancer Center. We
Mhm,
work with our colleagues to make sure that they're getting the very best care right here and
mhm.
Shar.
Mhm. Before we continue talking about this upcoming activity, who is Saville?
So Seville is the name of our center, the Seville Center, and it was started with a generous donation from a family, Mr. Paul Seville, who made our center possible.
Is he from this area?
Yeah, he's a Northern Virginia resident.
Do you have any background of him? Why he decided to, create this kind of center?
I mean, he's a pretty private individual, I'll tell you that much.
Mhm.
But I think he's just a really compassionate and giving man, and he saw the benefit of prevention and wanted to make sure
Mhm.
that there's an opportunity. Like when we got our marching orders to start creating the center, it was with explicit instructions that this was for all of Northern Virginia. This was not just for those who have insurance, not just those who have Fairfax, but we needed to make sure that our services were available to everyone. So I think he really does have a great vision for what the future of cancer prevention looks like.
I'm going to Google Mr. Saville.
I actually had the impression that it was from Spain because I was, Seville, Spain. So good thing you asked about it. Yes.
Yes. Because I know Inova, but I don't even know who's Shar. All we have to do is ask Wikipedia. And
Yeah.
maybe AI can help us. So, next question. Are the cancer screenings, tailored to a specific age, group, or risk factors?
So our general recommendation is that women start mammogram at age 40, that everyone start colon cancer screening at age 45, that we start pap smears at 21, that we do lung cancer screening if someone has a 20 pack year history starting at age 50, but we make a lot of changes to our screening recommendations based on family history. So if someone has a family history of, their brother had colon cancer, we're going to start that younger and go more often. So those are just kind of general recommendations, but we absolutely make changes based on personal and family history.
John, do you have questions?
Yeah, I was just curious about the demographics. Like, of course, if you compare it in the Philippines, they're more exposed into the women have more of the breast cancer and other stuff. But what about here in our environment? Who are the more prone in getting cancer as far as the studies is concerned?
Yeah, I'd say so. We're actually seeing the largest increase in breast cancer in the 30-year-old demographic. So it's still more likely that you'll get diagnosed older, but the increase we're seeing right now is in the younger cohorts. And that's the same for colon cancer as well, is we're seeing increases in those younger ages. And we're not entirely sure why, but it's something that we're keeping our eye on right now.
Wow.
Yeah, I was thinking because of the technology or the exposure to radiation and internet, there's additional for the brain tumor or something like that, as far as the technology exposure is, unlike back in the Philippines when we left, right? Not much.
I don't think we know yet, honestly. I think there's still a lot of research to be going on, but it's absolutely something we're looking at.
Now, how long will cancer screening, last? Because there are going to be a lot of people.
So, as far the screenings we're doing are during the event. Is that what you mean?
During the event, because some people they don't want to wait.
Oh yeah. So I mean, we do recommend coming early, first come, first served, but we will be doing it through the duration of the event.
Will there be any preparation or requirements for individuals before undergoing the cancer screening? Because I know, when I take that mammogram, they would always say, like, you don't have to put any lotion. Like
Lotion.
Nope, no special requirements. The colon cancer screening is a take-home kit, so that's something you'll do at home, but no special requirements for the skin screening.
How about the blood work?
So we will have a research enrollment opportunity, but again, for that you'll be 50 and older, but there's no special requirements for that either.
Are the cancer screenings, confidential, and how will the result be communicated to participants?
So the skin screening, the dermatologist will tell you right then and there if they see anything that they're concerned about or anything they want to recommend a biopsy for. And then the colon cancer screening will actually send a letter home. Everything is confidential, everything is treated with HIPAA protections, but we'll reach out to you directly with those results. Now, if that colon cancer screen is positive, then we are going to recommend a colonoscopy because this is just a screening test. And so that'll tell us if you need a colonoscopy or not.
Mhm. This is the reason why I love Inova. Again, we should avail all these services, especially this event. Everyone should attend, okay? I think even if you don't have cancer or you had cancer or you don't know, this is something, I think this is a great opportunity for everyone to be involved in the community and help the fight against cancer. Now, what follow-up steps will be recommended for individuals who received, like for example, they will receive abnormal or concerning results from this screening?
So if someone has an abnormal skin exam, then they're probably going to recommend a biopsy. And so we'll help you get in with a dermatologist to go ahead and get that little piece of skin removed. And then they'll look at it in the microscope under the lab to see if there's concerning cells. For an abnormal FIT kit, that's the colon cancer screen, then that next step is the colonoscopy. So we'll help you get a doctor so that we can get that colonoscopy ordered and completed.
Jan?
Yeah, that's a very good follow-up because of course some people when they go there and it just they just participated, but if there's no follow-up, then there's no result that's gonna come up with it, right? So I was just curious about how do you feel about the alternative kinds of medicines that are ongoing as far as any disease is being treated right now? Because some people, of course, they also are comfortable, especially on the Eastern kind of treatment, the herbs, the herbals, those plants outside of the house. How do you find about those things?
I think that there's always a really great way for kind of Eastern and Western medicine to work together. I think that there is absolutely room for both, and we want to take the positives from each side to make sure that we're really taking good care of people.
You know what? I'm really
Right.
hoping that the next time we would be able to interview oncologist, dietitian, nutritionist on this radio show. It's very important, to get their perspective in terms of cancer advocacy. What's the name of the doctor? Dr. Coleman something?
Dr. Kaltman is our oncologist, but yeah, we have a wonderful dietitian, Kelsey, that I'm happy to connect you with as well. She's
Yes.
been
Maybe next time you could do that for us, Liz, because we still have enough time to promote this event. Now, how frequently should individuals undergo screening for cancer for early prevention and detection?
So we recommend that mammogram and FIT kits for colon cancer screening, those are tests that are done annually. We want to do those every single year. A pap smear, it depends on the type of test you get, but typically those results are good for 3 to 5 years. And then skin screening, again, based on what the dermatologist sees, often once a year is plenty for that. And if someone has that 20 pack year smoking history, we're going to be doing that lung CT annually as well.
Is there an age limit when it comes to the, colon kit screening for cancer?
I think that that's a really great conversation to have with someone's doctor. Oftentimes the guidelines say, let's go through age 75, for example. But we all know that there are very different levels of health at age 75. Some
Mhm.
75-year-olds are just as healthy as some 40-year-olds I know. So we want to take this again individually and say, if you have a good 5 to 10 years that you feel like you're still going to be in great health, let's keep going. But again, I recommend that people talk to their doctor if they want to talk about any screening outside of guidelines.
Mhm. Okay. John?
Yeah, I really look forward to the event on May 18 and to try to explore all the other things that we could, like tie up with. And it's not just one particular occasion because our advocacy is always ongoing. So we could always mention that we have Innova as our partner in prevention care and
Mhm.
prevention of cancer.
It's
Absolutely.
nonstop.
I'm excited to be partnering with you all and to promote this event and get everyone some good information.
Mhm. Liz, can individuals with a family history of cancer, do you think they will benefit from the free cancer screenings?
Yeah, I think it's always good. We're going to have genetic counselors on staff too, so they can share their family histories and see if that's something that they may want to consider, some genetic testing. But it's always good to know about what your options are. And then again, it's just more information to help us personalize those plans and make sure that we're not missing anything.
Mhm. What resources or support will be available for individuals who may need further assistance or guidance after the screenings?
So we're going to have our Partnership for Healthier Communities team there, and they help enroll people in Medicaid and other government-supported insurances. We'll have our financial assistance program there. So that's for people who may not qualify for any government programs, but don't have the means to get health insurance. We'll have our community health workers who are very knowledgeable about different options available. We've got a whole team to help navigate people into care to make sure that we're checking all those boxes for everyone who comes through the door.
Mhm. In your line of job, what challenges do you face in your efforts to advocate for cancer prevention?
I think you touched on them earlier. There's a lot of fear.
Mhm.
Cancer is a scary word. And I think some people are like, oh, I'd just rather not know. But I think for us, what we're saying is this is there or it's not there. If we know what it is, we can better take care of you. We can have better outcomes. So we're just encouraging people to take that brave first step, come have the conversation, and let us show you what we're doing here so that you can decide if this is something you want to be a part of or not.
Mhm. Do you see also cultural differences?
Absolutely. Absolutely. There's cultural differences. And it's, again, one of the reasons why we have such a specific group of providers here in Seville. You'll see that our providers come from different backgrounds. We want to make sure that everyone feels comfortable when they're coming in and that we're thinking about things from a number of different perspectives. But I think that there are different cultural hesitations that come in. But, again, taking time, making sure that we have that inviting, warm community helps people explore what their options are a little bit more.
Mhm. Will there be interpreters?
So what we do have what are called our team member resource groups who are interested in different communities, and they're going to have buttons that say, I speak this language, written in that language, and so it'll be on their shirts. So if you come across anyone with a button, you can reach out to them and they can help navigate you through the health fair as well.
Mm-hmm. And some of these, I'm very concerned because, I care about others. No matter what, if you have a paper or no paper in America, you deserve to know in the status of your health. Now, some will be a little bit, I think, hesitant because, oh gosh, they're going to get my information. They might arrest me.
Oh, no, we're not sharing this information with anyone. We don't ask for any of that information. We too believe if you have a body, you have a right to do screening. So we want to just be here to partner with you and take care of you.
Mm-hmm. John?
And we also have to give assurance that, in the healthcare, there's always privacy, the right to privacy. And it's very foremost. We protect the patients also. So, no, definitely, that's a different case, like we separate what is legal and what is a privilege or a right for every patient.
Absolutely.
Yeah.
Mhm.
And I'm very excited again, as I always say, I'm very excited that we have people like you, Liz. You know, you don't know how you touch other people's lives. And by just talking to you right now, I think you already saved a lot of lives in terms of fighting cancer. You may not realize it, but you play a big role. Your job is not just
You
being
give
a counselor.
you
Oh,
give hope to a lot of people,
Yeah.
right?
well, it's only through partnerships like this where we can actually get the word out. Because again, you're right, there's a lot of fear, there's a lot of mistrust, but the more
Yes.
we talk about it, the more we normalize it, the better we're able to help get people in.
Mhm. Now, going back to that event, how can individuals find more information about the event and register attend?
Yeah, so we have an Eventbrite webpage that we'll send the link over that people can register. And then we have an information page on our Inova website as well that's got a couple pictures from last year and information on what we're looking for, or what we're looking forward to having this year. So we're just excited. It's going to be bigger and better than last year.
Mhm. Do you have like a social media accounts or are they active, on social media?
So we just use the Inova accounts. We don't have our own separate ones, but the Inova account's pretty active.
Mhm. What measures are in place to make sure the safety and comfort of attendees during this event on May 18?
Well, we're having security guards on staff who make sure that we're directing traffic appropriately. We have free parking for everyone. And then we've really put together a nice flow for the event to make sure that people know where they're going. All of our Seville and Inova staff and volunteers will have shirts, so we'll be very visible if anyone feels lost or needs help navigating. But we've put a lot of thought through how to just make sure that it's a really nice experience for everyone who comes to visit us.
Mhm. Is
That
that okay for attendees to bring their young kids? Because it's hard to find a sitter or daycare on weekends.
Oh, yeah, absolutely. And I think the kids will love the blow up colon and walking through the lungs. I bring my kids every year and they always ask me, is it time for the health fair again? And they help us think through other activities. So we
Mhm.
will have the bounce house available, lots of fun, interactive stuff for the whole family.
Yeah, I think it's very nice to see kids participating in this event. Not only that, John, I love kids. I want to
Yeah.
be their playmates.
So it's
John,
a whole family affair, right? So
yes.
it's not just like it's a purpose. It has a purpose at the same time. It's fun.
Mhm. You
Absolutely.
In
mentioned
fact,
about,
it's in
yeah,
fact,
go ahead, John.
yeah. I mean, I was just saying that in fact, this self-care perspective is actually an entire family involvement. So how about start it as a family affair in the first place, right? So yeah, we will be promoting it for the entire family in our
Mhm.
community here.
And this
Fun.
is not just a health fair, it's a family affair.
I
Mm-hmm.
love that. It sure is.
Mhm.
Mm-hmm.
Now, going back to your, a profession as a genetic counselor, in what ways do genetic counselors collaborate with other healthcare physicians and professionals as well as geneticists?
Yeah, so we have a really collaborative team here in Seville. And so we all get together and we have case conferences where we'll discuss different people's family history, their genetic testing results, and all of the different providers can weigh in, whether the dermatologist is like, oh, I think I should see that person, or maybe it's the gynecologist, or we have our Seville APP providers who actually follow people longitudinally. So they meet with them annually to check up in on their cancer care. So we really have a big collaborative team here in Seville that focuses on coming up with those individualized screening plans.
Mhm. As genetic counselor, do you provide guidance like on the management and prevention of, for example, genetic conditions?
Yeah, so I only focus on cancer-related genetic conditions. But yeah, when I get those results back, if someone has a predisposition to cancer, then I outline what are the general screenings that we recommend for someone with that condition. And then I'm almost like a quarterback, getting them to the team, getting them to all the different places they need to go and making sure that they're having those conversations.
My last question. How do you, like as a genetic counselor, how do you assess a person's family history to determine potential genetic risk?
Yeah, so the things that we're asking people are for their parents, siblings, children, aunts, uncles, cousins, and grandparents, anyone who has a cancer diagnosis, what type of cancer, how old they were when they were diagnosed with cancer. And then we use something called National Comprehensive Cancer Network, or NCCN criteria, to determine if we offer genetic testing. Now, the actual genetic testing is typically a blood draw, although sometimes it can be a saliva.
Yeah.
And then we're looking at what are called tumor suppressor genes, the genes that are supposed to protect you from cancer. Everybody has 2 copies of the tumor suppressor genes, but some people are born with a mutation or a change, so only 1 copy is working. So we're really trying to figure out if someone's born with 2 working copies or only 1 working copy. Because if you've only got 1 working copy, you don't have a backup plan. And if that copy goes out, that's when the cancer can develop. So we're trying to figure out from the day you enter this world, do you have those 2 copies or just 1 working copy?
Oh my gosh.
But it's very nice.
I did not even realize that.
And it's
Yes,
really
Jen?
nice that that's how you compare, like how you put it, so that we, the comprehension is easy to understand for that matter. So yeah.
Okay. So thank you so much, Elise, for, sharing your time with us on this radio show on the air with FACC, Filipino American Cancer Care. Lastly, again, your message to everyone.
Please come take care of yourself, get yourself screened for cancer, and come join us on May 18th. I want to thank FACC for all of the advocacy you do in the community, helping to connect people. And we just look forward to many years of combined efforts to help take care of all of Northern Virginia.
And thank you so much, Liz, for your service in the community. And I hope we will be able to interview some dietitians and oncologists at, Seville Center. Thank you so much, everyone, for being with us on our radio show. To our station manager, Johan and John, lastly, your message.
Thank you very much for having us also, Ms. Liz. And I would like to thank Innova for coming up with these kinds of programs. So see you on May 18th.
And Jan, I always forget to introduce myself in the beginning of the program. Thank you so much, ladies and gentlemen, for being with us. This is Josie Morales-Diamond from the Filipino American Cancer Care. Bye!
The Filipino American Cancer Care has just brought you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.